Camille, we are going to be talking about Clinician Fest today. And I'm super excited to pick your brain because this is your brain baby. And we are going into year 5 at this point for the conference, correct?
This is year 5? Or is this year
Year
4?
5. Slight flex on that. That's incredible.
Yes, yes. My baby's growing up. My baby's in like kindergarten now.
Yeah, the baby is walking and talking and is starting to form their own personality. And so I want to ask you about your baby. Start off by just sharing a little bit about Clinician Fest and how did you start Clinician Fest in general?
Clinician Fest truly started with just an idea around the kitchen table. And we were in the midst of being locked in, doing the COVID quarantine aspect. I had just been the night before rocking out to club quarantine with DJ Night. It's like, wow, look how we brought people together. What if we could do something like that in mental health? There at the time, mental health clinicians and practitioners, we were all in a scurry. We were all doing the very best with what we had. But we had social workers in one corner. We had licensed marriage and family therapists in another, case managers in one, psychologists, psychiatrists, nurses, nutritionists, the MDs, nowhere to be found. They were just out saving lives, doing what they could do. And I thought, what if we did this collectively? You thought about how everybody came together, how in an instant we learned how to become homeschoolers. We learned how to combine all our skills to do that. We learned how to bring people together to make sure everybody ate. We took people that had a sewing machine but really hadn't pulled it out in a minute. They came together, collaborated, and started sewing masks together.
Mm.
We started putting a lifeline back into society. And I felt mental health practitioners had to do the same. There was a time where we all work in silos, and Clinician Fest was born to relinquish those silos, to put us all in one room and say, what do you have that's working for you? What you guys got going on that's really nurturing the population that you work with? What are you doing that's changing the game? And I also knew that we could not do it the way we've always done it.
Mm.
Stale mentality had to die with our complete mindset from 2019 and beforehand. And again, like in all things, it was created on this virtual platform. In our last 5 years, we've kept that going, even though we've been outside, even though we can come outside. It's helped because this 2-day conference launches at the onset of Mental Health Awareness Month. But it allows me to sit in my living room outside of the DC metro area and break bread, thoughts, ideas, collaborate, network, and knowledge share with people in London, Alabama, Texas, my Cali folks, Michigan, Florida, New York, Trinidad and Tobago, Zimbabwe, South Africa, Australia, Sweden, London, France, all locations that have been represented at Clinician Fest through the years.
I love that. I love that. There's a little bit of foreshadowing because you talked about how turbulent a time it was in COVID, and that's when this was born. We're kind of seeing turbulent times happening again. And I think that it's a perfect time for someone who is looking for community, for someone who is also burnt out and just in need of being poured into for themselves. I think that's the other part of Clinician Fest that's really beautiful is the community that you've created for clinicians and practitioners to be able to pour into each other. Because if you all are pouring from an empty cup, that means that you're not going to have a lot to offer to your populations and the people that you serve. So talk about that aspect of it, that it's not just about knowledge sharing. Obviously, you'll be able to get CEUs. Shout out to, you got to give a shout out to our sponsors real quick. Hold on,
We
pause
got
that.
NASW, National Association of Social Workers,
Mm-hmm.
NBCC. So if you're a social worker, you can get your CEU, 16 of them. If you're a licensed professional counselor, you can come get your 16 from NBCC. So really blessed with that. At the end of the day, we all want this knowledge, but we also want some credit for it.
That's right.
2 days with Clinician Fest for it. So that's helped a great deal. Shout out to Bowie State University for being one of our sponsors and just all the people who pour into making this happen. If you knew, we have a zero operation budget. Everything is done through donations. Every dollar that comes in from Clinician Fest is gone right out. It pays the co-pays of individuals seeking mental health and wellness support. At this time, Turbulent times is an understatement. It is an understatement. So we have our hands cut out for us, our work cut out for us yet again. But we're finding that those who are seeking our support and help are coming from different genres of the population.
Mhm.
I grew up in an era where my parents' generation, and it was like you had made it if you got a good government job.
Mm.
Right now, not so much. That ain't the best job in town right now. People are losing their benefits. People are losing their ability to take care of themselves, their livelihoods, research, different things that were going on. And I happen to dwell in a pocket of our nation where we are being hit the most. A
Mm.
lot of our area right here in this Washington, D.C. area, many of us are either federal employees or federal employee adjacent, meaning
Mm.
you're a contractor or something that you do has an impact off of federal funding or federal input. And so there's a lot going on with that right now. And we're finding that again, where we were going, when we had gone through astronomical times of demand, we're upon it again.
Mhm.
We're upon the waitlist era yet again. We're
Mm.
upon can you see me eat at like 8 o'clock, 9 o'clock? Like now to whenever you can fit me in,
Mhm.
help me. These are the times that we're living amongst ourselves right now, and our population of help for the helpers is needed so much more. So we're asking you guys to take a 2-day pause to us to really feel those cup against. This is my airline approach. We must put our mask on first.
That's
You know,
right.
those planes. I used to say the Southwest approach. However, with these new changes they got going on with these bags, I'm like, come on, Southwest. That's what we were with you for. So now, instead of the Southwest approach, it's the airline approach. So many
Mhm.
of you guys have heard me use that term before, but we are pivoting now in
Mhm.
program.
Correct. Correct. Tell me a little bit about some of the stories that have come out of Clinician Fest. Either an example, if you can, without violating HIPAA, a story of where you were able to help an individual or a family as a result of this conference, and obviously folks who have paid to attend, sponsors who have also donated, or just a story of a participant or a speaker, someone that's also just been blessed to have been a part of that community. Share a story with us.
Actually, I've got a few. I've got one of our largest, we do a lot of data gathering collectives on like who we help, who comes to us, and what are the services utilized for. And we saw a great growth in in school age. When I say school age, college, grad
Mm.
school, resources who don't necessarily like maybe I have some insurance, but I can't pay that $40 a week copay all the time. So we saw a big influx in that. And we 3 students from NYU, and one of them had come back and asked, "How can I pour back in to Clinician Fest?" And they did this campaign on campus where it was just like, It was like she was just asking a question of what are your thoughts on mental health, the state of mental health today? And the responses, granted, they back in my hometown in New York City, so the responses were everywhere.
Mhm.
There was a common theme. It's not a conversation we can ignore anymore. You remember those taboo times where if you didn't quote unquote feel good, you're just like, yeah, I'm just, just going through some things. You were really, I guess, like what we want to say, politically correct about it.
Mhm.
Now you want to say, I'm depressed,
Mm.
not in a good space, I'm overwhelmed, I've reached my capacity, my aptitude of saying yes is beyond my aptitude to really follow through on that yes. And it was just some great or like just organic dialogue that she collected. We haven't put it out yet because again, we don't have everybody's consent for
Yeah.
comments and commentary that they put forward, but it was a beautiful internal project that she presented to us. Over 70 voices on this catalog of New Yorkers walking the city, just saying what they felt of mental health, what they felt the state of mental health was at this time.
I love it. I love it. Tell us what we can expect this year. What are you really excited about with this year's conference,
Oh my
and what
goodness.
do you hope people get out of it?
Such a diverse conversation for this year. We're moving into some waters that I must say, as clinicians, we do try to stay away from. We're moving in some more political rhetoric. Not too far deep. We're not, not going too far. But as clinicians, we cannot believe we're not political. Mental health is political. Social work is political. Therapy is political. And the aspect of those are what our clients show up with as their concerns. So we have to be versed in the conversation to help sustain those that we care for each and every day. So our panel is going to be phenomenal. This year, it is moving into the conversation of just the psychological impacts of this political fallout of what we call the United States right now. And it's not just the United States of America, but the United States of our world, generations that pour in, what it means to show up, what it is to be walking through a campus in Boston and somebody picks up a colleague of yours because their green card is of question because of a political statement that they had. But you're set to be in a class with them 20 minutes from that moment. What it's like to be a parent, taking your children to school, and now you're teaching two children who are in school in the worst of mental health states because their father is sitting in an El Salvadorian prison, despite the fact that he has been granted U.S. citizenship. So there is so much that has been pouring into the psychological impacts of individuals that didn't know they needed help, or psychological impacts of just the outpour of what all this is doing to people we call neighbor, people we call students, people we call friends, people we call colleagues. And so I'm just over the moon excited for the conversation that's state to be happening. And we have booked Dr. Wright as our keynote speaker this year. She is a phenomenal speaker, author, trainer, facilitator, taking some time to dedicate from her world travels to host a keynote conversation on redesigning mental health as we see it today. That is a must-see TV, as we say in the virtual world, keynote address that's coming down the pipes this year.
I love it. And before we wrap up, how can people support Clinician Fest? So obviously you can attend. And I think, the goal is for you to be a clinician, a practitioner. But if you aren't, I don't know that Camille is going to say no. But in addition to actually participating, how can people support you? What is it that they can be doing? Where can they go? Tell us a little bit more about that.
Click the button. Click that button to donate. Buy a seat for some potential. We need to build a pipeline. Us current practitioners, We's is tired, but we're still working. And our work includes succession planning. So we're trying to build a pipeline. So we're asking individuals to donate seats to Clinician Fest so we can have graduating practitioners this year attend and start on their journey towards licensure, because we need so many people to roll up their sleeves and help us with this onslaught of demand that's going on right now. If you are someone who has the means to donate to the wider cause, become a sponsor of Clinician Fest. We do work all year long. This conference is just a culminating factor of the deeds of our many busy hands. So we ask you to join in on forces. Click the button to donate. Reach out to us. Maybe you don't have the financial means, but you have some other resources that could help us, whether it be from meeting space, whether it be from being able to assist with graphic design, being able to assist with some media support, being able to assist with just getting the word out of what we're doing. There's so many ways to contribute that don't include just adding $1 with a few zeros behind it. We ask you to use your voice. If you see us online, hit us with that repost, hit us with that share, get us some followers, get us known and noticed. We cannot help everyone, but we've helped over 1,100 individuals since we started this. Yeah, and we're small. We want that number to be 11,000. Then we're trying to hit 1 million, because we know the population as we know it is in need of mental health care and support. And our work is just beginning. Like you said, we're 5 years. This baby's just started walking. We're about to get to running, sprinting, driving, and then jetting at this next point. So we need everybody to contribute. And even if you're a lay resource, come see what we talk about. Come get in the mix. Keynote speakers, come visit our panel. It is an open dialogue on our platform. So you can come in, grab a ticket, knowing where your funds and proceeds are going through, and know that you're supporting a great cause. So that is this year, May 1st through 2nd. That's a Thursday and Friday at the onset of Mental Health Awareness Month. So join us virtually May 1st through 2nd, 2025 at Clinician Fest 2025.